Washington and Oregon are grappling with upticks in coronavirus infections, bucking a national trend of declining case counts, a surge some experts and local officials are interpreting as a signal that the risk of COVID-19 is still lingering even as vaccinations soar. Hospitalizations also jumped in both states last month, according to state health agencies. Oregon had 334 coronavirus patients in hospitals on Friday, a more than threefold jump from late March, and Washington's hospitalizations increased from 286 in late March to 444 on April 11, the most recent date for which complete figures were available. Washington and Oregon are dealing with worse than average daily case counts despite having roughly average vaccination rates. Some 44.3% of Oregonians and 46.3% of Washingtonians have received at least one vaccine dose, versus 43.6% of Americans overall. The governors in Oregon and Washington have partially blamed more contagious new coronavirus variants for this latest surge in infections. In particular, a variant first discovered in the United Kingdom late last year is now dominant in the two states. Plus, Oregon Governor Kate Brown, D., says cases are spiking among younger people, most of whom still aren't vaccinated, and experts in both states warn some residents have grown complacent and stopped following public health precautions. "We've let our guard down to some degree," Washington Governor Jay Inslee, D., said Thursday. New restrictions. Brown reinstated a slate of strict social distancing measures across much of Oregon this week, shutting down indoor dining and capping other businesses' capacity, and Inslee, D., could reinstate restrictions early next week. "I intend to fully reopen our economy by the end of June, and the day is approaching when my emergency orders can eventually be lifted. How quickly we get there is up to each and every one of us doing our part," Brown said in a statement Thursday. COVID surge in Oregon shows U.S. fight against pandemic not over. Bloomberg, full coverage and live updates on the coronavirus.